Hi, this is Dr. Carolle Murat. I am the host of Claiming Your Fertility. And today our topic is keeping intimacy alive. And my guest is Dr. Karen Glass. Why don't you introduce yourself?
Okay, thank you. Yes, I'm Dr. Karen Glass. I'm a marriage and family therapist, and I specialize in working with couples and in sex therapy. So, sex therapy is the perfect place. Plus, I'm a registered nurse, and it's a perfect place to be talking about enjoying sex. Can you believe that?
Oh, you have to. It is very important. I was just reading a study where they're saying how for the men it is having a wife going through infertility. Or the couple, of course.
Right.
Or for her, whether wanting to get pregnant, checking, oh my God, I have my period again. And then, or going through infertility workup and having to have sex on demand and produce sperms. It's just like, how can you can just, I've seen it on TV, you can just read a magazine and then you can go into the bathroom and so the men. So the idea is that we're going to discuss how important for the couple to keep that intimacy and understanding how detrimental it can be if it's not.
Right, and you know what you're talking about is there really is a place at which relaxing not only helps you have great sex, but really helps you be more fertile.
Oh, yes.
And have healthier babies.
Yes.
It's amazing how it all comes together of just being able to relax
Mm-hmm.
and being able to enjoy sex.
Mm-hmm.
It deepens your relationship, and I've been working with couples for a lot of years.
Oh,
You know, and I've really have found couples tell me how much better things are when they begin to learn how to relax, because you know the physiology around that.
yes, because what's happening is, let's say there is that chemistry, there is that flow when you're having sex, there is that intimacy that you have, that the quality of the sperm, the ejaculate, it's better, so the sperm can flow better, and when the woman is really enjoying it and intimate with somebody they care for, they intimate with, having an orgasm where it's been shown that there are so many things that are happening at that level when there is that connection. So
Right.
that will make
Right.
the sperm gets better. There was some crystals. I've read so many things about it. But to make it in a nutshell, the sperm is better, more likely to get to the egg, and more likely to have a pregnancy. And then later on, we'll talk about how when the man is under stress, what's going to happen with him. So go ahead.
Well, in fact, there was a study a long time ago of Hartman and Fithian talking about how when one partner orgasms, there is a electronic signature in the other person's body. And so we're really connected. So when one of us is stressed, the other one feels it. And so I think one of the things we're talking about in reclaiming your fertility is kind of reclaiming your sexuality too, because when women get anxious and the couple's trying to have a baby, it makes sex work.
Oh, it is. Yes.
And it can destroy a relationship, actually.
Oh, definitely.
You know?
And especially if a woman having to go to intrauterine insemination. So that means, okay, I'm going to ovulate, and then you are going to go and get the sperm, and then we're going to do this, and the poor guy is working and doing something, and he says, okay, it's time, you have to come, and it's just like, so you can see how it can be, it could be very heartbreaking, and also the relationship. Also, we were talking about before that having the man feels like he's a sperm donor. What has been your experience?
Well, I really know that it's very difficult on couples when they're trying so hard. In fact, it's interesting. Even if a couple is not trying to get pregnant, they find themselves working at sex. That's the biggest thing that I find in my office as I'm working with couples, is I'm trying to tell them sex is adults at play, not adults at work, and they go, oh yeah. Oh yeah. So that is a really big deal. But especially when you get so focused. And you know, the other problem is that when couples are anxious, or especially women when they're anxious, it's a lot easier to start having fights and disagreements and upsets. We cut. So one of the things that I tell my patients at the office, and the thing that's most amazing, is I have to remind them to play, and that sex is adults at play, not adults at work. And they go, wow. You know, it's like they didn't realize that they were working. And you leave work at home, that's supposed to be vacation time. And the important thing about the vacation time, and in this case, fertility, of course, it's important for just enjoying each other and for your relationship, what I call the love bank account. But it's important for fertility because the circulation is there, the woman is more open and available. We get healthier babies. Yes. We get the science shows this, the sperm is more viable, more alive and moving and all of that stuff. So relaxation, circulation moving well. That's the only place that we can really have fun is when we're relaxing.
Yes.
And what I'm finding is that couples that are anxious fight more. They're more unhappy with each other. And that's not a good place to have a baby.
No.
You know, that's a good place to end the marriage, but not a particularly good place to have babies.
Yeah, and one of the things that, let's go back to having to go to the workup of having to have a baby. It could be not only negative effect on the woman, but also with the partner. And I mentioned before, having to have sperm on demand, and then having, the baby, I'm having my period. Remember, we read that where, and I shared it with you, where the wife will say, I have my period again, and then she's so devastated.
Right.
And then the man will say, but that's okay. We'll try again next time.
Right. And then she's upset
he
said that.
Because
men and women work on goals differently. Men are looking at getting to a certain thing. They're trying to accomplish things. They're trying to achieve something. And women are more into their emotions. So she wants him to understand her feelings, that I'm so upset. And he's saying, we'll get there. And she's going, but you're not hearing me. And he's going, but I'm trying to reassure you, in essence. Yes. And so it can be a real negative cycle when they're really trying to be there for each other. Mm-hmm. The more anxious you are, the worse everything gets.
So how would you suggest for a couple who they're trying to get pregnant, let's say that particular couple who's they're not even going through fertility yet, they're not going to IVF or anything, they're just trying to get pregnant, and say maybe if we try to get pregnant, or if we try to have sex for so long, let me say something, is just that the eggs last, let's say 24 hours, 6 to 24 hours, that's what the egg. So that's why where the pressure is, we have to have sex now, because otherwise the eggs is not going to be viable ever. And then so one of the recommendation is mid-cycle, the woman finding when it's the most fertile period in their menstrual cycle, and then just have sex every other day, because the sperm can last very long. So and take away the pressure from the men having to have sex more often or at a particular time. So
right,
yes.
That's a good choice if that works for the couple.
Yes.
And there are other pieces too, in that if sex is work, so in other words, if you're scheduling, it's real easy to continue the work attitude, right? Rather than recognize that there's ways of flirting, having fun, and of enjoying each other sexually, rather than having it all focused on
baby making.
It
just came to me. Baby making.
And that's a problem, especially for guys, because women are wanting to have that baby, so they're very often they're into it, and in fact that's probably the time at which they're into having sex the most, because I want that baby. But it's a problem if guys feel like they're just the sperm donor, right?
Yes.
Rather than we're a couple. So this is an opportunity, this is a time in your life when you can become more connected as a couple. You can deepen your relationship rather than have it be, this is a job. And really the couples that I work with, when they've made it, this is a job, it's kind of separated them. And now they have a baby, now they have responsibilities.
Yes, afterwards.
And they struggle afterwards of being a couple again in many ways. So really it's worth it. One, we're seeing it's worth it if you can learn to have that connection and learn to have that fun and learn to understand why you're having trouble being pregnant. If you have to go through IVF, then that's what ends up happening. But at least you're learning how to improve your relationship and how to have more intimate, more connected, more enjoyable sex. That intimacy is what can really make your relationship a good relationship for a lifetime. That's what I call the love bank account. There's different ways of adding to that love bank account. But for many couples, sex is one of those. And so it's really nice to see couples wanting to deepen their relationship because honestly, as a therapist, I see it when they're having trouble. Right? You know, I see it when they're close to divorce or when they're really struggling.
And fertility work could take a relationship that wasn't going well, take you there as well so quickly. So
that's right. And we can prevent problems later on too.
Yes. And one thing, bringing some science into this, is that when you are stressed, there was a study that's been published where there are many studies about how does stress affect the male. So it doesn't have to be just trying to get pregnant. Imagine you have somebody who has a high-stake job, a lot of responsibility, and then adding on to now the fertility. Adding on now we have to get pregnant. Studies have shown that when this is occurring, the sperm is of less quality, more likely to have malformations, and the motility is decreased. So if you go to a sperm count, they say, oh, the motility is not good, and it takes, and as well, when a man is stressed, so the chance of getting pregnant is lessens, and also the possibility of having a miscarriage from the sperms that is not as its best quality is increased.
Well, and as you're talking about that, it occurs to me that it might not just be the man. I don't know if they've done any studies on that, but it might not just be the man, but for the woman as well in terms of the quality of the eggs and
Oh,
all
definitely.
of that stuff too.
Of course, the way
Yeah.
comes with the woman, of course, a period, the more stressed she is, the more irregular periods. Yes. Oh, we could have a whole show on that. Yeah, but yes, but definitely. And then so it's just like, and it's working on ways of distressing is going to help both for the woman who's trying to get pregnant. And the last person I help, she comes from a culture, you get married, you get pregnant. But she works. She's a nurse, she's working, and then whenever she's with somebody, a family member, when are you going to get pregnant?
That puts a lot of stress on her.
Stress on her. But so now she wants to have sex with the husband, who also is busy, to have a baby. And then so when I saw her finally, and I asked her, what we found out, because of the cultural thing, she had to get pregnant. As the more time is passing, so now it's been 2 years. But about 6 months prior to the time I met with her, her period started getting irregular. She spent her time Googling, finding all the complications. So the more she's searching, the more she's stressed. So vicious circle where we have to have sex. Now I don't have my period. So she's being stressed. So can you imagine to the partner?
Right.
So it's essentially.
Yeah. And so one of the things that helps, because anxious people tend to fight more, right? And so really being able to kind of back off a little bit.
Yes.
But think about the relationship, because the truth is you're going to be with each other for a very long time. And if you end up being pregnant, then you're going to have a baby together, and you've got a relationship, and you've got to have other responsibilities that can take away from the relationship.
After having a baby.
After having a baby.
You don't want to have sex now.
Right,
yes.
Exactly. So it's so valuable to really work at developing that intimacy. And the thing is that what happens, I know you've experienced this, when couples get married, now they think, oh, well, now I've got this person and I don't have to do anything. I'm already theirs, they're already mine. So what do? They stop flirting, they stop taking each other out to dinner, they stop being their best self with each other and treating each other like guests. Oh, you're just my partner. But you know what? Yes, you are just my partner, right? I need to be able to give my best to you. Why do I give my best to all the guests and all the people around in my life rather than our best to each other? What is that mindset? Why do we do that, right? And so I find that when couples start re-evaluating and resetting their expectations of a relationship, and they start flirting, they start just enjoying each other,
taking a weekend off.
Yeah, going places together, having that love relationship. You know, when you're parents, you're going to be parents, but you're always going to be lovers, friends, partners, right? So those roles count as well as parent role, right?
Yes.
And the work that you do and all of that other stuff. So it's very helpful to kind of reset some things and to do the things that keep intimacy alive.
Yes.
You know, that's the love bank account, that's the connecting more deeply, knowing each other more strongly. I don't encourage no fights, although some people don't. I encourage
the sex is better
good
after
fights.
It's making up.
Yeah. For some people just really don't like, disagreements at all. It depends upon what your love style is. However, yes, for me, since I tend to be an intense love style, yes, I don't mind getting into a little bit because big passionate love and making up and all of that. Love that. Some people like to keep it calm and cool, but nevertheless, having productive, good fights, learning how to do that and what that looks like, and working together as a team, and having mutual goals. These are all what I call the 5 keys to successful relationships. And I like to teach that, and I like, there's a lot of different pieces that couples can learn.
So if people want to learn more, we're going to start putting some retreats together for couples. Right. We're going to start having women coming. So stay tuned, and for more information, go to the website, www.drcarolle.com, drcarolle.com, where we're talking about keeping fertility, claiming your fertility. And then we have Dr. Karen Glass.
Okay, and my website is sextherapydoctor.com, sextherapydoctor, so doctor spelled all the way out, sextherapydoctor.com.
So, thank you for tuning in, and Dr. Carolle again. We'll see you until the next time.
See you then.